This is Lucy. Lucy in the sky. Lucy came to us about 2 weeks ago. When she came to us, she was in very bad shape. She was as gassy as I've ever seen any pig be. She had a very profound infection in her little nose, upper respiratory. And we named her Lucy in the sky because we didn't think she was going to be with us very long. However, Lucy has decided that she's going to stay around a while. She's very eager to take her critical care. She's very eager to take her medications. And she absolutely loves her watered carrot juice. When you put her back, she just storms right back over. She's like, okay, I want it. Where is it? Give it to me. Doesn't take her long to eat her foods. Now, when she came in, she could not move. She was so bloated. I guess she was in a lot of pain from that. She was in pain from a couple of other things. And all she could do was sit in one little place. However, even though all she could do was sit in one little place, from the very minute that she came in, she was eager to eat. We initially just treated her for pain, thinking that she wasn't long for this world. She ate so well, we started treating for some other things. And as we treated for other things, she just seemed to get better and better. So now she's had some x-rays, and Lucy has a big old hairball in her belly. And the hairball is probably what's causing her to bloat so bad. So the doctor has us using some old-fashioned remedies to try to get the hairball to break up and pass. Lucy's not a good candidate for surgery because she's 9.5 years old. So certainly we're going to try just about everything except surgery to try to get this hairball under control so that we can get her bloat under control. So that's what we're trying to do with Miss Lucy in the sky. She didn't give up on herself, so we're not giving up on her. As you can see, I have to pump things in just as quickly as I can. She gets very impatient when she has to wait. She wants that critical care. She wants her medications. Like I said, she wants her carrot juice. And it's going to be very funny when we get to her carrot juice. If you take a look at her back end and the way she walks, you can see it's very odd. Lucy had some kind of catastrophic injury to her back legs. Her hip bones are fused into the socket. So she has no joint movement in here. Her knees do move, but her hip bones, her leg bones, her thigh bones are totally fused into her hips. So this portion here, she just doesn't have the movement. So she has a hard time lifting those little legs up. Anyway, we've given all of her critical care first before giving her her carrot juice, because once she starts with her carrot juice, she wants it. Now this is 1/3 carrot juice, 2/3 water. You have to be careful, even if a guinea pig's sick, to hydrate them but not give them too much sugar. And if I gave her pure carrot juice, and always use organic, you don't want a sweetened product, organic unsweetened. You just don't want to give them too much sugar and get too much bad bacteria going in their stomach, especially since she's already having problems with bloat. But as you can see, I have a hard time getting this filled up and to her in a timely manner as far as she's concerned. So if I get her back, because it makes me nervous to have her face right over me while I'm trying to get these syringes, she's just going to come right back up. Yeah, there she comes. She says, I want it all. You can see right now I can push. She's nice and loose, and she's also pretty small. When her bloat was at its worst, she was almost twice this big, and she was so tight that when you would touch her, there was just no pressing, nothing soft. It was very, very hot. So Miss Lucy, as I said, is very aggressive in wanting her foods and her juice and all. Lucy was actually turned in to a humane society and her family had asked that she be euthanized. I have a lot of mixed feelings about that. Certainly Lucy was in very bad shape when she came here, and the transport volunteer and I, neither one thought that she had much of a chance for much of a future. However, it's been simple care that our veterinarian has given her that's made such a change in her. Really very basic, simple care. I know it seems like I'm giving her a lot of things, but some of these things, I mean, we're talking over-the-counter baby gas drops that the veterinarian is having as use for her. So I do want to stress that when you adopt an animal, any animal, even a small animal, you have to be prepared to take on the veterinary costs that go with the animal. Lucy is going to have a few more months, a few more years. I don't know. She's supposed to be 9.5 years old. She's going to have some additional time with us. And that because of veterinary care. Without the veterinary care, no, she wouldn't be here. And we do try to get all of our adopters to understand that. And certainly anyone that's thinking about adopting a small animal, you have to be prepared. And you have to be prepared for those costs to sometimes run in the hundreds of dollars. So think about that before you adopt a small animal. You know, this is an adorable, beautiful little girl. She'd be worth a couple $100s if she were mine. So that's just something we need to always be thinking about when we're adopting any kind of a pet. Anyway, this is Lucy in the sky. I don't think she's going anywhere anytime soon. Certainly there's a lot more that needs to happen in order to get her to a place where she's comfortable. But as long as she's willing to work to get there, I guess we're willing to work to get her there. So you're going to be seeing more of Lucy in the sky. She's a dear, sweet, sweet little guinea pig. Okay, Lucy. Let me get it.